Hi everyone, this is Dr. Mini Malhotra at Anchor Wellness Center, and welcome to Crushing PCOS. So I just wanted to talk to you about a few things about people with polycystic ovarian syndrome have a different understanding about actually what's going on with their body. So a lot of people think that because PCOS is a complex disease, there is a complex solution to that. But if you go in a systematic manner, it's a very, very simple solution. So PCOS is a complex disease with a simple solution. You have to understand why you're having PCOS. Is it your foundation which is weak, like you have insulin resistance, or your adrenals not working well? Is it your thyroid? Or is it directly related to your sex hormones like estrogen, progesterone, and testosterone? So when you go in that systematic manner, actually you find the root cause of your polycystic ovarian syndrome. So actually sometimes PCOS can begin in the brain. So I would say polycystic ovarian syndrome starts in your brain. Now that may confuse a lot of people, and they may think, oh, my brain is fine, I don't have any problem. But it's actually the connection between the hormones in your hypothalamic pituitary axis, which actually control a lot of your other hormones. So it has control over your thyroid, your adrenals, it has control over your gonads or your ovaries, your testes, all these things. So it is a complex disease, but it can be a very, very simple solution. So people get really, really worried. People get depressed thinking about polycystic ovarian syndrome, and it has shown that people with PCO, especially people with obesity, have increased body image distress and depressive and anxiety symptoms. So there was a study done. It was shown that uh, if you do some intervention to improve the body image, it increases depression and anxiety. And the cause of depression and anxiety in polycystic ovarian syndrome is due to a few things like insulin resistance. 70% of the people are insulin resistant. The stress, it is stress because of the things that are going on, excessive facial hair or acne, that can lead to anxiety and stress. It also is due to inflammation throughout your body. So it causes polycystic ovarian syndrome because of the metabolic dysfunction, because of hormonal imbalance. It can cause high cortisol, and that can have prolonged inflammation. Another reason why you could be having depression and anxiety could be due to obesity, because obesity is actually associated with depression, regardless whether or not related to PCOS. So this is a big effect, especially with people who are obese with PCOS. So did you ever stop and think about how often we are told to change our appearance? Magazines constantly give us tips about losing weight, and in days you'll look slimmer instantly. It will hide the imperfections without actually knowing anything about us, and much less our appearance. So I used to read these magazines and get sometimes depressed about the suggestions, and I would try many of the things. Many of the sitcoms so frequently use overweight characters as a basis of many jokes, show jokes. So it's become a norm to criticize aspects of a body as sometime a bonding experience with parents, with the friends. So if we all hate our bodies, sometimes makes us feel connected and united. So body shaming or criticizing yourself or others because of some physical appearance, it can lead to a vicious cycle of judgment and criticism. So what we should care about is what we want, and not what they want from us, like looking slimmer or smaller or tanner. And if we don't, we worry that we are at risk of becoming someone else's body shaming target. So what should we do? We should do something that makes you feel happy. Spend time with people who love you as you are. Sing at the top of your voice in the shower, dance around, do something that makes you feel beautiful. So get a new haircut, treat yourself to a manicure, wear a favorite outfit, do something that makes you feel accomplished. Like if you have some skills, maybe sewing, or maybe embroidery, or making a new project, or helping, cooking, whatever you like. Do something nice for someone. So maybe give somebody a compliment. Help your neighbor with something. Like right now we're going through this coronavirus crisis. Maybe if you are going to the grocery store, you can ask people that, do you need any help? Other ways you can combat this depression, anxiety is by meditation, mindfulness, guided imagery, and self-hypnosis. And I will talk about each of them, in the next episode when I go on YouTube Live. That's next Wednesday at 3 p.m. So stay tuned for that. And I would love to share some of these things which I use myself in my life that has helped me a lot. Not only balance hormones, but keep me calm and prevent the negative effects of polycystic ovarian syndrome. So as I said that I had polycystic ovarian syndrome, and obesity was the major thing for me. I didn't have other things like hair growth, acne. So everybody can have different things. Everybody can have different aspects of polycystic ovarian syndrome, but all of them actually, if it is continued, so you can make this polycystic ovarian syndrome dormant in your body. So you can make it dormant. It doesn't really go away because there is some genetic predisposition. There is some degree of inflammation, some degree of hormonal imbalance. So we can use all the measures to correct the hormone imbalance, but to keep it in that balance, we really have to work in the same fashion to keep it, in the same levels or the optimal levels. So remember that your body doesn't need normal levels of hormones. And you may be surprised why I'm saying that. It actually needs optimal levels of hormones. So thinking outside the box, there is no guidelines for treatment of polycystic ovarian syndrome. You're just treating the symptoms in conventional medicine. So in my next episode, next week, I will talk to you about how conventional medicine looks at polycystic ovarian syndrome and how they treat polycystic ovarian syndrome compared to functional medicine approach or the root cause approach, which can actually help you reverse this PCOS and keep it away for life. So take care. I hope this information was helpful to you. Please write a comment under this if you need any information, and we can also send you a free 7-day PCOS diet plan for glowing skin and hormone balancing. Take care and bye. I'll talk to you soon.